Has there ever been a time in recent memory where we've had to spend so much time worrying about other people's choices, which we don't have control over? And how much does other people's choices, you had pictures of walking down the street, and we all probably have played this game at some point. You kind of wonder about somebody's backstory. And if you're Sherlock Holmes, you can probably like say what that is, but none of us are, right?
Yeah.
So now we're in a world where you go to the grocery store and you're not only playing that out in your head, but you're wondering what choices did this person make today that might put me at risk? And you can't find out. That's hard. I mean, it makes me think, gosh, we can't, not only do we not capture these data, we're not even asking the questions the right way.
Happy Podcast Day, and welcome to Informatics in the Round, a podcast designed to help everyone become a part of the dialogue about topics in biomedical informatics. I'm Kevin Johnson, Physician and Informatics Chair at Vanderbilt, at KBJ Vanderbilt on Twitter, and at www.kevinbjohnsonmd.net on the web. Season 2 is here. I wasn't sure if I'd ever be able to get to a Season 2, but I have enough followers that it was pretty clear we needed to do it. I took a couple of months to recharge and plan for this season. I also spent some time writing. My husband and I were participants in the Moderna vaccine trial, and I thought it was my duty to help encourage people of color to get the vaccine, so that's been a focus for the last few months. It continues to be a major problem, as you know, and I'm continuing to do what I can, as is Rob. But I also know you're trying to get your 10,000 steps in a day, and not having a recent episode of Informatics in the Round is affecting your health, so here we are. Our first episode of the year should have the theme, Meeting Guests Where They Are. We welcome back Sarah Bland, who was a regular on the podcast, and for which I'm so thankful. Sarah is a leading project manager in our informatics department, and is so knowledgeable about informatics and precision medicine, but also has a life that she's going to share with this episode. She's had a lot going on in the last few months. A lot of it relates to this topic, and I was pleased that she was willing to share it with everyone. Alyssa Abler and Hannah Smith are a wonderful team. In their professional life, they are the singer-songwriter duo called The Daily Fair. Check out their brand of indie Americana soul music in this episode, and on their website, which is www.thedailyfairmusic.com, or on Facebook. Alyssa and Hannah also have had quite a few experiences over the last few months related to COVID, and were, again, very comfortable sharing them with us, and really took us in a direction that we weren't planning, hence the idea of a theme, meeting people where they want to go. Colin Walsh is a national expert in predictive analytics, also known as AI, occasionally called machine learning, focusing on mental health and behavioral disorders. Dr. Walsh is also a physician and cares deeply about wellness. That will become very apparent in this episode. So, what data do we as informaticians need to help people manage life after COVID? That was the initial focus of the episode. But one of the themes of the conversation, as you heard in the lead-in, is what are the actual questions people need to be asking today so that we can capture the information they actually need us to know as healthcare providers? It was a great episode. I learned a lot, and looking forward to your feedback on it. Speaking of questions, by the way, I need to hear from you about topics you want us to cover. I'm on Twitter at KBJ Vanderbilt, and you also can leave me comments on my Facebook site for Informatics in the Round, or on our Podbean site for the podcast. Well, let's get to it. Hope you enjoy. And yes, there's some great music near the end, so listen to the whole show. That just sucks so bad, I can't even tell you. I was 40 some. Oh, Sarah, you were with me when that happened.
I was gonna say, I had the PTSD from that.
We recorded, I think, one of the most dynamic, funny, vibrant, just, I mean, the limoncello was flowing. We had all
It
kinds of stuff
was.
going on. And then as everybody's leaving, I looked over at my computer and nothing had been recorded.
Oh no.
And I was
The
like,
pain in my heart. It was
and, I,
bad.
and the worst part was I had to decide, do I even tell them? Like, do I go, thank you, this was great, see you later, holy shit.
Oh
or
That is a
man.
or
bummer.
and I just told them, I said, we'll do this again in pieces. So we did we recovered. And it's, as everybody who's ever done anything like this, I'm sure you guys in the studio have had this happen. You have to do all of those things at least once and then have the scar tissue that prevents it from happening again. So
Well,
Colin, tell us about you.
sure. Hi, everybody. My name's Colin. I am a faculty at Vanderbilt, obviously, in biomedical informatics. I'm a doc. In part of my time, I do primary care. A little bit of my time, most of my time is doing research, building predictive models that we hope are useful, which is the most important thing. And we tackle problems like suicide and prescription overdose and treatment resistance, which is somebody with depression who gets medication and doesn't do that well on that. And how do we build models that help us identify those people early? So that's me. And we run a lab at Vanderbilt, not far from where Kevin's sitting right now.
You think I'm sitting right there, but this could be a virtual background.
That's fair.
I can tell you it's actually not today for other reasons. So Alyssa and Hannah, tell him about you.
We are an Americana soul duo here in Nashville.
Listen to
Yeah.
you. You did not actually classify yourselves as Americana Soul the last time.
Yeah.
I don't know if we knew last time.
I think we did. I don't think we ever. We mostly, I think, just were like, I mean, we're in a room full of geniuses and we're songwriters.
Yeah.
Yeah, we're getting ready to release our record on March 3rd. As those
Really?
in Nashville know what March 3rd was last year. It was kind of the pinnacle, or rather the beginning of us not putting out a record last year.
Yeah.
Because we were going to do it the third week of March, and then we were still doing tornado cleanup. So we kind of just pressed pause on things for pretty much a year.
Yeah.
Tried to find a way through it. And
Now, are you going to tour or do anything with this album?
Hopefully, at some point.
Whether it's this year or next year or the year after, we will, God willing, tour out the actual record as it's meant to be. But on March 5th, we're doing like a beginning to end performing it with this group here in town called Tune Den. And they are wonderful artists in their own rights, and they have a studio where they basically, it's meant to help artists have great live performances recorded.
Nice.
So we did a show with them a few months ago, and we asked them if we could come and do our release show because the quality of the product was so great. So then eventually releasing that as a thing as well. So yeah.
So Colin, this will be your chance to ask Music City insiders any questions you've ever wanted, because I'm gonna give you the little lecture that I've been giving lots of people around COVID, and then we can go ahead and get started because I want to help everybody up. So this whole thing about we're a bunch of really smart people, and I can't believe we're in the same room with you, which of course you already know I think is bullshit, but I'm going to tell you why, and particularly I think that way. I'm really no longer as convinced about what it means to be an intellectual or smart as I ever was. Whether it be a grove of birch trees or cicadas that choose to stay underground until the right time. I think we've just all evolved to be clever in different ways, and as humans, we interpret our ability to be clever as intellect and smartness. I think we have a giant built environment. We, in some ways, live in a giant Potemkin village. We have no idea, COVID reminds us just how vulnerable this whole environment is. I mean, what would happen to us if we lost electricity as a species for a year, right?
I literally just had that conversation with Alyssa last week.
Yeah. So how smart are we really?
We build fires in our backyard. We cook all the time. We have all the utensils to literally exist.
I mean, and how are you you growing your vegetables?
Yeah.
Do you kill your own meat?
I could, and I mean, I have a bow and arrow and a machete. I mean, I have a lot of things from a very weird life I've led. That people would be like, really, you have that skill set too? Like, yep. But it's something I like, zombie apocalypse. I'm ready. Let's go.
Yeah, you are. Well,
I feel like she might be more ready than me for some of those things. But,
so you just don't let her go.
but yeah.
Right.
So we'll just jump right in. So the reason I thought this would be a great group to get together is because we've all been through COVID, and each of us have had a very different experience with COVID. I should ask the question: has anybody had any personal experiences with COVID at this point?
Oh yeah.
Do you want to?
Yeah.
Are you comfortable sharing it?
I got permission before we got started for sure.
Good.
So this is Sarah. I like to start off like that. Got it from Big Bang Theory.
Yeah.
So for me, in the past year, my wife had COVID and back in November, actually December. She is a respiratory therapist, so she thought she had COVID a couple of times from exposure. Thankfully didn't, but in December she did. But my father-in-law actually got COVID back in November, was in the hospital for about 6 days and then was gone. He did not think, he didn't realize he was going to die until maybe 4 hours before.
Oh
He
my
didn't
gosh.
know that was actually happening. And as a result, our life has changed significantly. So,
I think significant is probably an understatement.
yeah. So, my father-in-law was keeping a 10-year-old boy that he was family friends with. And so when he went into the hospital, we ended up taking the 10-year-old into our care, and now we have custody of him, potentially long-term, if not permanently. So we went from being a family of 2 plus a zoo of animals to a family of 3, all because of COVID. So.
Wow. Well, I would say my heart goes out to you, but I know how strong you guys are, and that's the last thing you'll need. You just need us to, get out of your way so that you can succeed. So.
Yeah, I will say though, the learning experience of being able to see COVID firsthand. I've been helping with the COVID registry that we have here at Vanderbilt for since about April or May of last year. So to see it firsthand was a whole different experience. To be in the ICU, to see the different patients. I've grown up in the hospital, never seen anything like it.
So Hannah and Alyssa, do you guys have any idea what a COVID registry is?
It sounds like where you put
Why
everyone's
don't you?
name that gets it.
Yeah, so here at Vanderbilt, we have this really amazing ability to de-identify records or pull them from the medical record system to be able to use them for research. We get consent from patients to make sure that they don't mind that we're using this data. When COVID started, we knew that this was going to be really important for us to collect information on the COVID patient population here at Vanderbilt, because we knew so many patients were going to end up probably in our care instead of rural hospitals. So we started pretty quickly. Josh Peterson and Lisa Bastarash in the department started a registry to be able to put that information together. So essentially, it's just taking all that data and saying we want to segregate it so that we know it's the COVID patients, and then starting to pull other information that might seem like it would be pretty important information, like smoking status, or if they're inpatient versus outpatient, did they get intubated and put on a ventilator or not, things like that.
And usually I'm not for segregation, but in this one case, I thought it was really important.
Yeah.
So let me tell you how I'm going to weave all this together, because Colin, although kind of junior, he's moved very quickly through the ranks here and has become very well known for the work that he's done with suicide ideation, suicide attempts, and using data of the type that we would have in one of these registries potentially to identify these patients before they have an event. And Colin, can you say a little bit about that?
Sure. Yeah. Our research program, gosh, is just about 5 years old at this point. And we really started from a simple question, which is, can we use data we're already collecting for other reasons to do a better job of identifying those people who may be at higher risk than somebody else for things we care a lot about, like a suicide attempt. We did that by partnering. We work with psychologists and suicide researchers, and now psychiatrists and social workers. We had a call with wonderful friends in the Navy that includes captains in the Navy down to folks who are actually doing the care on the ground. So really everybody has a stake in this. And our work is really intended, the key word here is useful. We're trying to make models that we know won't be perfect, but might be useful to better identify those people who might be at risk for suicide. And just this week, we were talking with folks like Lisa Bastrash, Sarah, who you mentioned, thinking about that COVID registry to say we're seeing more and more data that mental health for those who had COVID, much less those around those who had COVID, is really affected. So we see an opportunity to think about, well, can we design better tools to find people who may be suffering?
Wow. I can see Hannah and Alyssa, you guys are thinking about something. What are you thinking about?
My family is very sick currently with COVID. And I mean, I think we could all, just in general, looking around at, people on a Zoom call or people we've seen in the stores or friends, we've distanced with, like, this year has weighed heavy. And how do you even quantify, people who, I mean, I feel like the entire population is at risk for
They are
just an upspike in suicide and mental health issues. And I've noticed it in myself. Like, there's this like super feeling, and Sarah, I'm sure you felt this way too. Like you like can be like really strong and bold about it, but also there's this part of you that goes, well, I can't fix this. Like, I can't make my sister not have COVID. I can't make my mom not have COVID. I can't make my dad leave the house because he's already been exposed and now he's sick. And then my grandma died of it. Like, it really it's hitting my family really hard in the last couple of months. So I guess more of it is like a question of being who I am. I go, okay, well, I need to talk to somebody so that I don't end up in a position where my family ends up spiraling. You know what I mean? Like that being aware of your own mental health to prevent it from affecting certain ways. But I
mean, just remember, it takes courage to even say what you just said, and give yourself credit for that courage. I think if our work has made any difference so far, it's that it's made it, we think, in some small way easier to talk about, because it's a hard topic. And mental health and suicide, even in 2021, there's a lot of stigma there. And step one is we got to talk about it, because if we aren't able to talk about it, we're never going to fix it. So thank you for having the bravery to speak up as you did.
And it's and I think oh, go ahead.
I was just going to say, I have noticed recently a bit more of people stigmatizing it again, where like I felt like we were making headway about people being better about speaking up about their mental health, or at least going and getting some help. But since everybody is struggling, there's almost this like, well, just get over it.
Yeah. I would add that I think the two of the mental health things that I noticed the most would be that one, with my wife and with our kiddo, they both felt at a loss. Like you said, there's absolutely nothing we can do. My wife is a respiratory therapist. And so of all illnesses for her dad to die of, an illness where he couldn't breathe. And that was his main complaint, is I just can't breathe. Her entire family, who are not healthcare related or knowledgeable, were looking to her to fix him. And we finally had a doctor who was able to put in terms, we just can't do anything. So that helplessness weighed very, very heavily on her, especially after they finally were able to help him make a decision of, okay, I don't want to be intubated. I know that's not going to help. And really seeking counseling for that has been so important for her to be able to talk through that, because it comes in waves. Some days she knows that intellectually this is COVID. There's just not much you can do with someone who's 65 and has other illnesses and, has had COVID for 3 weeks. The other side of it is to watch a 10-year-old feel the same way, to feel when I had to tell him that David died, and they were very close. It was like a grandfather for him, or an uncle. I mean, he's known him his entire life. And so I was the one to deliver that news. And it was the part that ripped me apart most was that he felt like it was his fault because he had gone to school, or did I not wear my mask enough? Did I give it to him? And so he assumed it must have been him that caused the illness, and it wasn't at all. We got him tested. He was negative. He had been tested several times around that and was negative. It's just that, my father-in-law happened to go out and probably went to a restaurant and had exposure. Just to watch a 10-year-old deal with that, and to have the terms of, I don't know if I should be alive if he's not alive, and things like that. It's just not something you want to hear from a 10-year-old. And so the seriousness around this for younger populations, I think, is really, really key to study and understand, because I can't imagine what it's going to be like in 10 years for them dealing with this level of trauma.
With everything that's going on with this, this disease and all the ways that it's impacting families, I continually ask myself, is there going to be a way that we can use the data and the experiences we have right now to somehow not have the other shoe fall, right? Not have the sequelae of a disease. And for those of you who don't think about this, in medicine, there's this thing that we can get called strep throat. And strep throat used to be, you get an infection in your throat. Maybe you didn't need to take any medicine because it just went away. What people didn't realize was that strep throat was a setup for another disease called rheumatic fever, and that the same exact organism disappeared and then reemerged and affected your heart. So now we have COVID. There are early data that suggest all sorts of things that may be related to the loss of taste and smell. There are certainly this group of people who nobody wants to call long haulers, but by using that term, everybody knows what we're talking about. And I can't help but think that there's something in the data for the patients now who've lost their lives that could actually tell us something about the future for people who didn't, in terms of sequelae. So the question I have for Colin is, so, you're a pro at prediction. So we have this registry. Are we setting ourselves up well to be able to answer these longer term questions, as well as to hopefully get people services before they might actually need them? Or is there no hope?
So there's hope. The first building block is measuring what we're doing right now. It's step one is counting. People we know have been touched directly by COVID is the place to start. And if we track that, we monitor that, we now have a registry that allows us to follow these folks over time. We can see what's happening for them. But it also becomes a catalyst for conversations to say, okay, well, what aren't we capturing? What aren't we doing? How do we reach the people in that person's sphere, their network, their family? How do we reach out to those people? What data are we not collecting? We rely so heavily in our work on data we're collecting to deliver healthcare, but so much of that is around things like billing, a medical diagnosis code. That's not necessarily the data it's the data, I often say it's the data we have, not necessarily the data we need.
Right.
So do we need to expand to the data on somebody's smartwatch if they consent to give it to us? Do we need the data on social media? Do we need data around finance, which we never have in electronic health records, and the facts that people have lost their jobs, or they've watched their industry collapse because restaurants are shut down? Those are stressors we're going to have to think a lot about. We don't have the calipers there right now. But the first step is measuring and counting what we're doing right now. And the registry, I really think, is the start to do that. And then also, again, we already talked about talking about things that are hard to talk about. This allows us to have that conversation.
Oh, that's great. So Hannah, Alyssa, Sarah, are there things that are happening in your world right now that you'd say, boy, I wish my healthcare providers had that? They would know a lot more about what's going on with me, or they would be much better able to treat somebody else who maybe isn't as comfortable sharing.
Maybe I brought this up last time we spoke, and I'm not going to call back to that episode in case anyone hasn't heard it. But
do. I'll
okay.
make sure I mention it twice that way.
Yeah, I've become a much more open person in the past decade or so with my own information and my own life, and I'm not sure that there's anything often to be gained by being too secretive
Right.
about certain things. So there, depending on how people grow up, honestly, I think that's where like a lot of that fear initially comes from, and your background with the medical world versus the religious world versus where like the environment and the types of people you grew up around. A lot of my mentality has shifted over the past several years to just realizing that more openness is actually better and maybe more challenging at times, but it's so freeing on another level. Like I don't think that I mean, I don't have a lot of things to hide about my health, and especially the stuff like I can't donate blood because I had melanoma, and realizing that's something that I wouldn't have thought of prior to experiencing all the things I did with that illness.
Mm-hmm.
But that's something that ran in my family, and I didn't know anything about it before I actually had it myself. I think the people that work in food service and that essential kind of work, however you want to classify it, anyone doing that kind of job has had to take a much more drastic approach to their own awareness of who's around them, because there are strangers. Like I'm a barista, there are strangers coming in to where I work all day long. I don't know where they've been. I know where my friends have been. I know where Hannah's been. I know where my coworkers have been for the most part. I hope. Like there's only so much information you can really trust, and knowing that you're going to come into contact with X amount of people who you have no idea what their home situation is or what kind of socializing they've been doing I think I've gotten over the stress of that at this point, because it's just there.
How about exercise? Are you guys exercising?
We kind of
Well,
I love the silence. So much.
That was
so
what is this Excel size of which you speak?
we don't work out. We we're active human beings. So my gardening, it's a very, very physical thing that I do. What I do for a living is a very physical thing. And I make sure that I'm doing stretches so that I don't damage myself, and yoga and things like that to just kind of bring stillness to my super overworked body.
Are you doing more or less of that with all of the family stress?
I'm working more. I would say, but that I realized this week was actually more of a mental strain on me.
Mm-hmm.
So I actually I put 2 clients today that know each other and socialize, so that I'm not overexposing them to me going from house to house kind of a thing. I clean houses. I don't want that to sound like I'm doing anything weird.
No, I was going to ask. I wasn't completely sure.
Actually,
because I'd have to declare this whole podcast as a different kind of podcast on Apple if you hadn't done that.
Right, exactly. No, so I'm a on-call personal assistant and home organizer.
Oh.
And but I wear masks and gloves when I go into people's homes. I wash everything when I leave, and then I shower when I get home. Basically treat it like I'm a doctor going out, coming home from surgery.
So as I hear you saying all this, and Colin, I'm hearing her say, so obviously you're having a lot of mental anguish, and both of you are experiencing the fact that the jobs that you're in when you're not doing songwriting, although I'm sure you're doing song developing while you're doing them, put you in the hands of strangers who you have to trust, and that probably has some physiologic effect on you. Mm-hmm. Do you ever feel your heart racing, or do you feel yourself having a hard time sleeping because of all of those experiences?
Over Christmas, I traveled for Christmas. I did the big no.
Uh-huh.
I was very safe about it, as safe as you could possibly have been. Got tested before I left. My family all got tested, but my parents, because of their jobs, have kind of socializing responsibilities.
Oh.
And I had a super meltdown because I've not been doing that. We've not been touring. We've not been hanging out with a lot of people. Yeah. That was a big one. I had to go in another room and just calm down, because people, that's that moment you go, okay, not everybody is doing what I'm doing to
Right.
make sure other people are safe and that I am not infecting them.
Yeah, I mean, it makes me think, I mean, gosh, we always worry about our own choices, but I feel has there ever been a time in recent memory where we've had to spend so much time worrying about other people's choices, which we don't have control over? And how much does other people's choices, you had pictures of walking down the street, and we all probably have played this game at some point. You kind of wonder about somebody's backstory. And if you're Sherlock Holmes, you can probably like say what that is, but none of us are, right?
Yeah.
So now we're in a world where you go to the grocery store and you're not only playing that out in your head, but you're wondering what choices did this person make today that might put me at risk? And you can't find out. That's hard. I mean, it makes me think, gosh, not only do we not capture these data, we're not even asking the questions the right way. When's the last time you felt unsafe? What do you do that brings you joy today? We don't ask those questions. And that might be more important than any of the, the diagnostic codes we've got. For those people around them, and certainly in the longer term things we're talking about, I think we have to start thinking that way. I mean, systems that are more compassionate in that way, and ask people questions that are actually important to them, as opposed to those questions that are important to us.
Yeah. What I hear you saying a lot, Colin, is something that I don't think healthcare does often. And I think about it this way because I think about contact tracing and how hard that has been in this.
Oh my gosh.
I'm not starting that. Okay. I'm just saying, as the public health person here, contact tracings have been a little bit difficult, not very great. But I hear what you're saying, and I think you are trying to take healthcare and make it preventative, which is not something healthcare usually is, because it's really, I get sick, I go to the doctor, especially if you are someone in a economic situation where that's where probably the only time you go to the doctor. If I get sick and I have to go, we don't in America really think about healthcare as preventative unless maybe the dentist, and even that is difficult to really quantify for a lot of people. But you're saying, hey, we need to think about how one thing my wife and I talked about is how the holidays are tough for us now. It used to be a really fun thing, and now it's a little bit tougher because of everything that happened around the holidays. So we're more cognizant that next year we might need to think about that, instead of just getting to Thanksgiving and Christmas and acting as normal and then all of a sudden being upset. Let's think about how can we make it a little bit different to think about our own mental health. So you're thinking about healthcare as a preventative model, not so much as the usual come in when you're sick.
Yeah, we talk about it a lot, and we're a society. We reward heroism and we reward reaction. When it's like you look at how often CPR on TV, and how often is CPR successful on TV? It's more than 3 out of 4 of the times. How often is it successful in real life? It's less than 20% of the time, depending on who you ask. So, it's, Kevin, I can ask you, when's the last time a parent thanked you as a pediatrician for preventing, I don't know, polio in their kids? Has that ever happened?
Law school 7 years ago.
Right? Right? Nobody's ever thanked me for preventing that heart attack they weren't.
Actually, you know what? I do have an answer for that. It was Jesus. He was 7 weeks old, and they were so happy that I was able to remember. No, just kidding. I'm probably in trouble for saying that, by the way. So, Colin, it sounds like what we've got to do is we've got to develop an app that pertains some kind of predictive stressometer, so that patients can carry it around, and as the holidays loom, if their cumulative stress has hit some point, we should be able to say to them, don't do that. Don't do this. Don't do the stressful thing.
Yeah, there's a couple pieces. There's the passive piece, which is like, hey, we're checking. You give us permission to do that. Hopefully we get permission to do that. And we're seeing your behavior seems to be really different than it was the other day. And maybe you're just not wearing your watch anymore. Maybe something's really changed for your life. You were sleeping 7 hours a night. Now you're sleeping 3. That's big. Then there's the active piece, which is helping people be more engaged. We talk about that a lot too, but we know people are willing to, we see this right now. We're willing to share with each other because we feel comfortable doing that. There's a therapeutic effect to just sharing, right? We all know that. Like I went through something really tough, and if I get to talk about it, it's not nearly as tough as it was before I talked about it. So I think it takes all kinds. And I think, we said before, it's overwhelming if you try to think about all the building blocks and all the pieces, and it totally is. So knowing that just those small wins are going to end up being the big ones, if we just carve off pieces that we think we can get to.
I think it's doable, though, in what you just said, especially in the passive way, because, if my heart rate increases, my iWatch will tell me you should take a moment to breathe. It will tell me every hour or so to make sure I stand. And there's other apps that already do that, and they integrate with health on the iPhone, and My Health at Vanderbilt integrates with health on the iPhone. So there should be some way to connect some of these things, and say, we want to help you check in with your own mental health. Help us help you, if that makes sense.
Yeah, I mean, look at that the CDC's done with VSafe. For those of you who may or may not know about that, as they're vaccinating people, people get an opportunity to share a cell phone number, and then they text and say, hey, we're going to check in with you. Can you answer some questions? It takes seconds for people to do, but it's a way to say, hey, right on the device you probably are already holding, answer some questions. And oh, in a week, we're going to check in with you again. And it's not a big investment. They've tried to make it as easy as they can. And I think that's going to enable them to do some really interesting things and help us learn more quickly in scaling out a vaccination effort that's never been done before. We're going to learn a lot. Yep. Because they figured out a smart way to get to people.
I will say that in the research area, there's been a technique that we've used called ecological momentary assessment. And the whole idea of ecological momentary assessment is catching you at random or maybe even prescribed times every day and asking questions about how you're doing and what you're doing in that moment. So as I listen to you, Hannah, talking about everything that you're doing, and Alyssa, the work that you're spending and the stresses, I can imagine that if there were systems we had in place right now to ask you a question before you got to work, how excited are you about going in today? And you knew that there was a COVID surge, you would manifest that in an answer that would be different than it might have been on a rainy Saturday when you didn't have anything to worry about. You were just not particularly excited about going to work. Am I right?
Yeah, I was actually just thinking I have some apps that actually do that every day. They say, how are you feeling today? And because I am aware my mental health is here or there some days. And it reminds me to take some time and to breathe and to meditate, be aware of myself throughout the day so that I can find a safety. And also I was thinking there's another app that I use, just full disclosure, it's a period tracking app, but it does ask
what
they've but they help you decipher patterns in your mood and stuff like that leading up to, so you can kind of be better aware of what if something is happening to you mentally, it might be tied to this, but it's also a very real thing, a physiological thing that you're going through, and it talks you through what is actually happening. It's like medical in the way that it talks to you on kind of a real level, though, saying these are things that are happening. If that is what makes me feel like I'm getting a bearing and I'm not going to just go out and hurt somebody or hurt myself, and that data needs to be used to check in, I think there's a way to helpfully do that for people, because we really have no idea what's coming around the corner mentally for people when this passes.
This is Kevin Johnson, and you're listening to Informatics in the Round. And now I want to come back to this point. Let me ask Colin a question about this. So Colin, all of these data that you're now hearing, we are not capturing. Do you think it's going to matter? Do you think that that we should be making this a priority for the field right now to figure out how do we get in the mind space of a lot of the patients who are being affected by this disease so that we can understand these things in the future?
Not every problem needs a predictive model, right? There's a lot of problems we have just fighting this pandemic that aren't going to necessarily respond immediately to what we're talking about here. But I think to seed the field for longer term health and prevention, and being honest about how much we don't know. And I think it was Hannah, I think you said it the best, we don't know what's coming, right? So being honest with ourselves about how much we don't know that's coming, and seed in the field so that we've got a good chance of if we don't know what's going to come, how can we react a little bit better? And how can we be prevention focused, as Sarah, you said so nicely? I think it makes sense to do. I don't think it's the thing that we need to kind of keep the lights on and get the water flowing in the pipes right now. But that's just because we're fighting this uphill battle against this virus that just keeps changing on us and doing challenging things.
And we're on the other side, I think, in the arts, who, at least Hannah and I, in our creative process and in our daily lives, since we do live in the same place, we have made a practice of asking each other and our friends all the questions that you were just asking about how you're doing today, how like, tell me about your last, like, tell me about your week. Tell me what happened. Did anything, like, what are you thinking?
It's been really fascinating because some people are like, wow, no one's asked me that all year.
Yeah.
And
Wow.
I
And
think
we're
it's
like,
something-
well, that's scary.
yeah. Whereas we do it daily. I mean, I do it daily with at least a couple of people,
Mhm.
because that is like, what if you're, it's going to happen at some point. All of your
Mhm.
technology fails you, as a bunch of us in town found on Christmas.
Mhm.
We didn't have ways of communicating beyond the space that we were in physically with
So
people.
since we have an international audience, what happened on Christmas? Can you
Oh.
remind people?
Yeah,
Because
the
as if
Christmas-
COVID wasn't enough here in Nashville, as if tornadoes weren't enough here in
Yeah.
Nashville, as if
And even-
floods haven't been enough.
God.
What else?
Yeah, so the suicide bomber of Christmas morning in
Oh
Nashville.
my
Like, and
gosh.
I was at work when that happened, and I saw it on Twitter, and I was the one who told my boss, and who, like, a friend of ours had reposted something. So, and their phones later, like, weren't working. So it was kind of that moment of realizing just how fragile so many systems that we've come to rely on truly are, and what happens and what is available to people when all of those external forms of communication, beyond just being able to speak and physically communicate with someone, like, when you lose that ability to reach out,
Right.
what else can you do? And that's something where with music, with art, with any other form of the creative, or the the creative arts, not that what you do isn't creative, that is something that I think in the art world, it's just a natural way of engaging with one another. We've learned to ask those questions, but we've not really learned the data side. We don't think of it in that way, but it's the same thing on some level, I think.
Yeah, that's really true.
Thinking about the loss of technology. So, out here, we lost our internet and cable for 3 days. So, a 10-year-old who had just gotten all these new game systems for Christmas, that was
I'm trying
really
not to laugh. I'm
perfect
trying not to laugh.
timing.
Yeah.
It was
So-
perfect timing.
Okay, wait. I gotta
So-
set this up. So all the stress going on, you and your wife are trying your best to be brand new parents,
Yeah.
and somebody says, you're almost ready, but first we're taking out the electricity.
Yeah. Exactly.
I think the most seasoned parent I know would have crumbled right then and said, we're out. Go outside and play. I don't care what temperature it is.
It was my first night being Santa too, and so
Jeez.
Crystal had to make sure that he fell asleep, so it was up to me to do everything. So it snowed, and so I, bundled up, and we got him a bike for Christmas. So thankfully, there was one thing that was not related to the internet. But
Mhm.
I had to go under the garage door and get the bike inside and everything. So I thought the hard part's done. I have been Santa for the night. We've gotten through. He's gotten all of his toys, and at 11 o'clock, the cable and the internet went out, and we're just like, so. But mentioning the loneliness thing and the connection, it was interesting because my mom lives 10 minutes away, and she lost her internet for just a very short period of time, but she went into a panic because she has isolated. She has an aortic valve, and so and she's 65. So she, for the past year, has really pretty much only gone to the grocery store and gone to work when she had to go into the office. She's come over maybe a handful of times to our house, and that was after we isolated. So she lost her power or lost her internet and thought, my only lifeline is now gone.
Yeah. Wow.
And so the loneliness factor hit very quickly. Thankfully, hers came back, and we were able to move all the game systems to her house. But it was really interesting because you mentioned, Alyssa and Hannah, the check-ins. That became a lifeline this year for my mom, who is a very social person, to not have any interaction other than the grocery store. And really, it showed in her mental health significantly, because she would have good days and she would just call and say, I just need to talk. I know I'm not going to talk about anything important, but I just need to have human interaction today. How many people in America don't have that? I can't help but think there's probably a significant amount. And that's a data point that I don't know her doctor will ask her. because we are already seeing that and actually I think it came out in circulation today, that there are associations with cardiac health and psychological health and mental health. So with her having a history of heart disease, I wonder how much this year will have effect as well on her cardiac health.
Think about that a lot.
Yeah, I was thinking about, Kevin, your question before, do we need to be collecting these data now, or what question should we be asking? And Sarah, you said it. The question we may want to be asking now is, how connected do you feel, whatever that means, and how, or on the flip side of that is how isolated do you feel? We're social creatures, even if we're introverted, and I'm an introvert by my nature. I always want to feel connected to those around me in some way, or feel that I've got that. And losing that is a really hard thing. And we definitely don't measure that right now.
That is so true. I mean, I think we're probably all somewhat introverted here. And even if it's just a 5-minute call, enough to know that there's a person I'm thinking about who can be thinking about me, it makes a big difference. And we don't know. And I would wager that one of the things that we should make as a product of this podcast episode is a commitment to make sure we let our doctors all know how important it's going to be for them to ask us those types of questions for the next few years. Because I do think that some people are going to get the vaccine early, some people aren't. There is a lot of loss of life here. And I think there are some people who have such strong stress responses that they're not even going to process this until many months down the road, when it's kind of like when you go on vacation and you get sick. I think the second dose of the vaccine is going to make a few people relaxed enough that they can have a good cry and get together with friends and have a lot of hugs. And we in the healthcare profession and we who are in informatics probably should be learning how we can support them during that time.
It did. You're exactly right. And I will share an embarrassing moment of myself that I had not processed all that had happened to us since November 23rd until the day after I got my second vaccine, just 2 weeks ago. I knew that my wife needed me to be very strong for her and needed me to be here are the next steps. So, no problem with the funeral home. I did all that stuff. I did, I've worked with DCS, everything. I got the second vaccine and I got a really bad headache from it. And the straw for me was I read the article that the giraffe at the Nashville Zoo had stepped on its baby and killed it.
No, I didn't even know this.
I teared up about that.
Okay, well, spoiler alert.
Oh my God, I had no idea. I watched that baby get born.
Right. Everyone, the world had, Kevin. And so I read this article, I read a tweet about it. I immediately called my mom sobbing and I said, it's dead. It's dead. And she was like, what are you talking about? And Crystal heard me and Crystal was just like, get it together. And I was like, I can't, it's the giraffe. So it's just so tragic. And it was like, that was it. So I cried for an hour and then I finally got through everything else that had been built up. But that poor giraffe, it's always something about giraffe.
That baby giraffe was such a metaphor for this whole last year. I mean, you have no control over this creature, but you are so excited for it and you can't do anything.
Why do I feel like there's a song in this for you?
Don't worry, I wrote it.
I mean, a lot of the new record is about just watching the story of your life and the people who raised you and the people you've come to know throughout your existence. Like, it's about not knowing where you stand while you watch this life happen around you sometimes. So
this is like too good a segue not to take it. Is there a song from the album you guys want to play? You guys okay? You mind listening to a song?
I'd love to.
Did you want us to play it live or should I send you a track?
I want you to do both.
Oh, well, I'll send you the track for sure after this.
Okay. It's called The Baby Giraffe. Which one is called The Baby Giraffe?
We're going to make Sarah cry again.
The hook will be sticking your... Hey, the hook will be sticking...
The Tides. The Tides is the theme song for that.
There you go. I was going to say the hook will be sticking your neck out, but that's not particularly good. Colin, stop laughing at me.
I'm laughing with you. I'm laughing with you.
A sad song or a sadder song?
I've heard your last album, so let's go with sad. I don't think I can take sadder.
Okay, we'll do the runaround then. We just this song's actually out. We released this single a couple of weeks ago.
Awesome.
Yeah.
Colin, you're in for a treat. They are really amazing, and harmony is just to die for. So.
Absolutely.
Can't take back my words unsaid when truth escapes in a stolen breath. Silence grows as you pass my way, but you don't know, and I won't say that I wish you would chase me down, hold me close and make me know I was worth the time and worth the pain, the run around, the pushing down, our lifelong game. Would you return or turn aside for futures known or lost in the night? Or would you sail to the farthest moon to bring me back the heart I've thrown? Chase me down, hold me close and make me know I was worth the time and worth the pain, the run around, the pushing down, our lifelong game. Oh, the game we play, all the games we play, all the games we play, all the games we've played. Still I wish you would chase me down, hold me close and make me know I was worth your time and worth the pain, the run around, the pushing down, our lifelong game, the run around, the pushing down, our lifelong game.
That's not so sad. It's a little sad.
That's the sad one. The other one
Yeah.
is way sadder.
Yeah.
It's about the
A
concern of
lifelong
being an
game. Is that
alcoholic.
what's the name?
That one's called The Runaround.
Yeah.
Hmm.
Yeah. So what does that make you think about with regard to like everything we've talked about?
You asking?
You guys
Oh,
wrote it. Yeah.
We did. I mean, that song is truly written about watching a relationship fall apart. So, but not being in it.
Yeah.
So I feel like that's been quite a bit of what I've been doing this year, but also seeing myself inside of it now.
Yeah. Yeah.
I think we could say
Yeah,
that
that push you
about-
down part. Yeah.
Go ahead.
It really hit me. It's running around and push you down.
Yeah. The
Yeah.
Runaround, the pushing down,
Yeah.
our lifelong game.
And there was so much of that going on.
Yeah, that's actually a great line. It's really a great line.
Yeah.
And I say that both from an artistic perspective, but also because it like relates to so much of, to me, I hear that and I think about, I mean, unfortunately, I'd also think a lot about the politics that we're going through right now too, because there's been a certain amount of that relationship that has also had the exact same kinds of, you know, it angers me so much. I shouldn't be going here. I wish I hadn't gone here, but I'm going to go here
Go
now.
for it.
No,
It
it's
just,
okay.
oh,
I was
You have
actually going to
to.
bring up kind of part of that
I
in a
mean,
second
in the
too.
setting of everything else that's going on with COVID, and obviously everything else that's happened here, the fact that we have really had to go it alone societally, means that there are clearly, it reminds me of this book, Bonfire of the Vanities. It's clearly been this set of activities going on around us that we have no control over, and you watch them and you know how it's going to play out, and you just can't. It's almost like you don't want to watch it again, but you kind of have to, because maybe this time it'll be different. Maybe there really will be a vaccine supply that will be announced that now we find out, of course, doesn't exist. Or maybe there really will be a statewide response to the need for mask mandates that we were all asking for, and then you find out it's just a suggestion. Yeah, I mean, there's been a lot of the pushing down and the running around right now.
And there's two different realities that have been occurring, and I think it does tie in greatly into what we have been talking about this hour. That I have actually lost friends, very close friends, who live down the street from me, because even if I have access to some of the most up-to-date information and accurate information about COVID, they believe that science is not. We are not good people, and we should not have the data that we do, or we're trying to use it for bad things, or there's some other conspiracy that we're helping contribute to. I mean, I know somebody who their sibling works in the CDC, and they believe that COVID doesn't exist. And so there's just been two divided groups and division. And really, that does have a huge implication on healthcare providers and what we do in healthcare, because you have people who go in. And like I said, my father-in-law did not think he was going to die of COVID until a few hours before. He really thought he was going to be okay. He thought that he had taken all the precautions. He thought he had read somewhere that he had a blood type that was not meant that he was going to be fine. There's just so much information that was going out that he thought, I will be fine. And so, do I think that he was safe? I think that he tried his best. And do I think that that maybe he was misled by some information? Possibly. But at the end of the day, he and I lived in different realities sometimes, because I didn't go out hardly at all unless I had to go to the store. And he thought it was safe enough to go to a restaurant every once in a while. At the end of the day, we are living in two different pockets of the nation, in our country, where some believe that healthcare providers are really out there intentionally trying to help, and some believe that they're intentionally trying to hurt.
Well, I'll say one thing about that song and that hook, which is, we've talked a bit about the role that data can be playing if collected sort of prospectively outside of the healthcare system. So it's sort of a part of it, but not exactly. So if we had technologies on your phones that were asking you questions, the other part of that is, it's a bonding opportunity, isn't it? I mean, you talk about the fact that if the healthcare system is going to watch you from a distance and you're watching it from a distance, then everything that you just described, you can actually sit there and say, there they go again. If we are in your pocket, it may feel a little bit more like we're trustworthy, especially if we were actually using those data to say things like, I noticed you haven't been moving around as much, or I noticed that one of your parents hasn't opened the refrigerator all day. There hasn't been any activity in the house. Then maybe when that same system comes back and says there's a vaccine that you really need to take, you'd almost anthropomorphize it enough to believe it cares about you.
There's good evidence to show, and mental health specifically, there's better evidence for things like talking to a machine, conversational agents and chatbots. Like, people are more willing to do that. And sometimes they're more willing to be more open in that, because there's a sense of like, well, I can say it to this because I won't feel that judgment that a person might have for me. But what I'm thinking about is, like, I felt this tension, but I think if we're going to ask people how they're really doing, we have to be willing to go where they want to go.
Yeah. One one of the things that I think has made this feel more real to me, because I really haven't had a lot of, I've not feared for myself at any point really, and my family has stayed very healthy through this. So, but I have friends who have gotten sick or who and recovered, thankfully, and we have a lot of friends who are in the medical field who have been telling us about their experiences with this. So in a way, I feel like I've been able to gain a different perspective because I do trust these friends of mine who are medical professionals who have been telling me what they have been experiencing, where in my, at least as far as I'm aware, a lot of my family members who don't necessarily, or acquaintances who don't maybe believe that this is as big of a thing as it is, it's partly to do with the fact that I have that intimate relationship and trust built up with these people who are in a profession that is on the front lines of this literally every day.
Right.
So it's given me a different ability to understand what I'm not actually experiencing myself, because I know this person's not going to lie to me, that they've sent me masks that are more intense than the ones that I maybe could get on my own, because they care and they believe how they are seeing a different thing that I'm seeing. So that's made a big difference in my believing that this is real.
I will say Jane Bach, I know Sarah's had a chance to meet Jane. Jane is a songwriter who's also been on the podcast a couple times last year. She has written a lot for Reba McEntire and others. Jane made a point of saying that trust has been by far the most important weapon that we needed all of last year. And in every conversation about informatics, whether it be conversations around, the issues that you guys brought up before, which had to do with disclosing medical information and data privacy, or whether it be issues that relate to predictive analytics, as we're talking about some today, a lot of what we're talking about with regard to sort of the disinformation campaigns that are happening, Jane and others just kept saying, we all needed that port in the storm. We all needed that place where we knew there was trustworthy information. Sometimes the technology was the most trustworthy information you could have. And I think maybe one of the messages that I'm hearing you guys tell us is, let's keep getting back to how do we unify? What's the role that fields like ours, informatics and public health informatics, can be playing to unify as well as to deliver? Because I think that the service delivery piece doesn't work so well if people don't trust you, as we're learning right now with the vaccine.
Yeah. I think a lot about, I grew up in a very rural area of Virginia where the family doctor had taken care of most of my family for a number of years. And so he knew a lot about our family and just what was going on day to day. So, if someone got sick, he might proactively call our family and say, does someone need to come in?
Yeah.
And so, we're at a point, I don't think, where we can have family doctors and rural health situations like that for all Americans, but we have a lot of technology that could do something very similar. We've talked about it. So how do we bring that feel, that preventative healthcare, and that more compassionate feel to all folks? Because we've seen, even with this pandemic, where some communities were marginalized and left out in areas. But how do we bring it to everybody? And I think healthcare systems can bring that that ability to bring trust to all different types of communities.
Well, this has clearly been the clarion call for this podcast, is information both to help us in the future, but really to help us in the present. Colin, any last word?
I just have a lot to think about. I think Sarah, what you said. So it's easy for us to talk about technology in people's pockets, but just remembering how many Americans even don't have that technology in their pockets, and the fact that to make that equitable, which is another important conversation happening today, is so important, and it can't just be on a smartphone. We have to reach people where they live, not where we want them to live.
Absolutely.
One of the episodes I'm going to do this year, and hopefully, and everybody, we'll talk more about who can come on and everything. I want to have an episode with some Spanish speaking, hopefully bilingual people, because I am terrible at Spanish. And I'd really like to understand, are you guys bilingual?
Our neighbors are a bilingual family. If you
connect us, if you will.
Can help with that at all, yeah.
Yeah, because I think, one of the things I've discovered is, as much as we've said it was great about telemedicine, for example, patients with limited English proficiency have been left behind. There was simply, I mean, I've heard so many stories ranging from the fact that we have a Spanish version of our portal here at Vanderbilt, but it requires a knowledge of English to activate it. And so if you can just get through those first couple of pages of 100% pure undecipherable code, which is English, then it's all perfect for you. It's like, okay, great.
Yeah.
Okay, it's late. I've held you up.
Oh, thank you, Kevin. And thanks for having us on again. It's always, well, it's becoming always lovely to talk to you all. All of the 2 times.